Hi, I'm Dr. Mark Miller. I've had an amazing response to my offer to give away my secrets on how it is I'm being prepaid at $98 to $121 per office visit in my short-term $3,000 to $5,000 programs of care. I have an e-report also that you need to read. There's some amazing information in there, and it goes into much more detail than what I'm going to share on this short video. I'm going to go over three big things on this video that will, if you just add those to what you're doing, it'll affect in a big positive way how you're being reimbursed for your talents as a chiropractor. Here's the thing about chiropractic practice. Almost all doctors are talking about how the messages start in the brain, travel from the brain down the spinal cord and over the nerves to all the organs and cells and muscle parts and so on. Everybody talks about that that's practicing the vertebral subluxation complex type of practice. But here's the thing. Very few doctors are doing any kind of brain assessment measurements or tests. They don't do any kind of what I call related functions. And those related functions are measurable, and it's a very impressive thing for the patient to visually see that being performed. When they see that, they know that they found a different type of chiropractic specialist. And a lot of people that come to you have already been to a chiropractor or two. But when they come to you, they'll see a whole different level of specialty. Now I'm going to go over three things rather quickly about the big things about how it is I collect usually $103 to $121 per office visit. My $98 per office visit is a discount, additional discount that I give some of my patients. But my normal thing's $103 to $121. Here's how I do it. It's my focus of care. See, it's the focus of care that your practice is structured around. If you have a smaller focus of care, your practice will reflect that. The smaller focus of care is the care of just the spine. If you have an expanded focus of care, you'll include the brain, spinal cord, central nerve system, and the spine systems. So focus of care is paramount. And I have figured out a way to demonstrate to the patient a significant focus of care that they want to have in their approach to getting well. The other thing is the office procedures. See, your office procedures right now are focused on your focus of care. It's built around that. Well, when you change your focus of care, your office procedures will slightly change. And that difference is part of why I'm getting $103 to $121 prepaid per office visit. Here's the next thing, the presentation. Listen, in my view, most chiropractors do not act like a specialist. They act like, you know, the friendly doctor on the corner. It's too mom and pop. And that's why you're being paid $30, $40, $50 or $60, whatever, per office visit. It's too mom and pop. If you want to be a specialist, you have to act like a specialist, think like a specialist. Everything you do has to be presented like a specialist. That big thing is presentation. There's an old saying in business. A product well packaged is half sold. You need to package your services and present them as a specialist would. Like I say, I'm not any more talented than you. My procedures don't take any more time than yours, and my results that I get in practice may or may not be any significantly different than yours. I have just figured out, I've been doing this for 30 years, but I've figured out how to present everything as a specialist. How to present yourself, all your office procedures, and most importantly, your focus of care has to be that of a specialist. If you talk it, you'd be well served to walk it. If you talk it and don't walk it, you'll probably end up with $30, $40, $50, maybe $60 per office visit. But if you walk your talk and you measure what you can measure for the patient so that the patient has the maximum experience they can have, then you can position yourself to be prepaid at $103 to $121 per office visit. Listen, I love hanging out in my backyard. And so I got to get to the office though. So I'm going to exchange this look here for this look here. This is the look that I have when I'm at the clinic. That is an important part of being paid at $103 to $120 per visit prepaid. Listen, if you want to practice where you're collecting $30, $40, $50 per office visit, I guess you could look however you wanted to look. But if you want to practice where you're being prepaid at $103 to $121 per office visit, you should look how the patient expects a specialist to look. They already went to the other doctors. They already went to the other specialists. They know what a specialist should look like. They walk into your office, they see you in a golf shirt, short sleeve shirt with a tie or something. They go, oh, okay, well maybe this isn't the specialist I thought I was going to see. And why put them through that? The patient should have to do no gymnastics in their brain in order to see you as a specialist. The truth is that we do tell the book by the cover. And so you might show a great cover to demonstrate that you're the specialist that they should be seeing. All this stuff up here is not for me. It's for the patient. And when the patient's, when I'm with the patient, a lot of times I'll look over here to the right or either I see them reading all that stuff, and it's very important for them. They need to feel secure and confident that they have found the specialist they're looking for. My program covers all aspects of your practice, from how the patient should be greeted when they first come in, the setting of your reception area, the hallways, your treatment rooms, the therapy suite, your adjusting rooms, all of those things I address. I address the consult history, the exam, the x-ray setting, the first report of findings. Now I do what I call a test procedure in between my first report of findings and the second report of findings. That test procedure is what sets me apart as a specialist. I do brain-related functional testing, and I test the patient so that the patient can see what the true state of their condition is. It's not just about their neck pain or their back pain or their this problem or their that problem. It's about brain and central nerve system function as it relates to the spine and the body. And so I do tests that set me apart as a specialist. My DVD program covers everything. And the second ROF, or the exact recommendation of care, is made. There's nothing else like this. If you want to go from where you are to where you could be, you need a program to show you the way, or you're just going to have to spend your time, waste your time, and spend thousands of dollars someplace else trying to figure it all out. I've taken 30 years of experience and put it into a program where I share my secrets of how it is I'm being prepaid short-term programs of $3,000 to $5,000 at $103 to $121 an office visit, and I show you the track to run on so you can do the same thing. There's 3 reasons why a practice collects only $30, $40, or $50 per office visit, and here's the 3 reasons why that occurs. It's because of what the doctor is doing, how the doctor is doing it, and the value or the low value that those patients have for the services being offered. There are 3 reasons why a doctor is collecting $103 to $121 per office visit. Here's the 3 reasons. It's because of what the doctor is doing, how the doctor is doing it, and the value or the high value those patients have for the services being offered. You're going to be doing office procedures. Now, some of those procedures are going to produce $30, $40, $50 per office visit, or you could do a different procedure, same time, slightly different, and produce results that pay you $103 to $121 per office visit. Because of my DVD program, there are now brand new doctors in practice. There are doctors that have been in practice 10, 20 years, even a doctor that's been in practice for over 42 years that have taken simple steps in their office, increased their new patients, and significantly increased what they're being reimbursed for their time and talent as a chiropractic specialist. I would encourage you to take that same action step. You have nothing to lose but the money you're already losing because you're not being paid as a specialist. My program is completely different than the traditional practice management programs who are charging an arm and a leg for what they're offering. This is Dr. Mark Miller saying, take a simple action step. Be paid as a specialist. There is no better game to play in practice than to play the game of being a specialist in chiropractic and being paid as a specialist.